We are going to be sending money to Indigenous communities for them to use the way they need to.
Tonight, the federal emergency response package allocates $305 million for Indigenous communities. But when will the money flow?
People in the downtown east side, they all have compromised immune systems, and if it gets down there, it's going to be pretty scary.
And dealing with the COVID-19 pandemic on Vancouver's downtown east side. Good evening, welcome to APTN National News. I'm Dennis Ward. Today, the federal government revealed more details about how it will allocate $305 million to Indigenous communities to address the COVID-19 pandemic. But one opposition party is questioning the length of time it may take for money to reach those who need it. Jamie Pashagumscum has more from Ottawa.
This morning, Justin Trudeau said Canada is hard at work getting needed resources to Indigenous communities as quickly as possible.
We are going to be sending money to Indigenous communities for them to use the way they need to keep their communities safe through COVID-19 and support access to supplies they need and get through this difficult situation.
Meanwhile, on Parliament Hill, Indigenous Services Minister Mark Miller finally made an appearance at the daily COVID-19 Cabinet Committee press conferences. He said the emergency funds will allow communities to make their own decisions on what is needed to fight the pandemic, and that the communities don't need to declare states of emergency to access the money.
We cannot shy away from the fact that this is not a question of if, it's a question of when, but Indigenous communities have a chance to prepare and address this and flatten the curve on a community basis. There's also a number of related elements into remote and isolated communities that we need to address.
Miller also stressed the need for emergency pandemic plans, and that although 87% of Indigenous communities currently have plans in place, some need to be updated. In a statement today, NDP leader Jagmeet Singh said that he's skeptical that the funds will reach these communities in time. He said communities need funds immediately and that the government should work with these communities to develop plans for the likely outbreaks that are coming. Jamie Pashagumscum, APTN National News, Ottawa.
To Quebec now, where a case of COVID-19 has been confirmed on Kahnawake Mohawk territory. APTN's Lindsay Richardson has that story.
Hours after giving a daily update, the Mohawk Council's COVID-19 task force in Kahnawake returned to streaming platforms with another.
I'm here today to advise the community that we had a first positive case of COVID-19 in the community.
But with the bad news came some good.
There's absolutely no need for contact tracing by public health or by KMHC in any way.
The person afflicted is a doctor at Kahnawake Memorial Hospital who canceled clinics and self-isolated after returning from a trip to New York City, therefore avoiding contamination. The hospital's director of professional services commended the doctor for acting appropriately at the appropriate time. The Mohawk Task Force agrees.
No, it's not a matter of if the virus reaches our community, it's a matter of when.
Already under strict prevention protocols, the task force says there's no need for new measures in Kahnawake at this time. Premier François Legault confirmed Thursday that Quebec is now equipped to perform up to 5,000 screening tests daily. As of this broadcast, there are 121 confirmed cases of COVID-19 province-wide. 7 of them are in hospital. With numbers growing every day, Legault urged Quebecers to stay in their regions. International travel through the U.S.-Canada border will slow in the coming days. Also announced Thursday, officials with the Nunavik Regional Board of Health are instituting a flight ban to restrict non-essential travel to the south. With thousands of screening tests still processing and 1 Quebec death officially on the books, Kahnawake insists their case of COVID-19 is proof that staying in is the best way out. Lindsay Richardson, APTN National News, Kahnawake, Mohawk Territory.
Ontario announced a second COVID-19 death today. Halton Region Public Health reported the deceased man is in his 50s, who had underlying health issues. Elena McDougall has more on the situation in that province.
As of this morning, cases of COVID-19 had risen to 257. 43 new cases were announced today, most in the southern part of the province. It is not yet known how many of these are in First Nations communities. Anyone who suspects they have symptoms of the virus is asked to call their doctor, public health, or telehealth. Christine Elliott, the province's Minister of Health, said 1,300 new lines have been added to the service, and now more than 2,000 lines have been made available. When questions are being asked about what is being done to ensure First Nations are being tested. In an email, the Ministry of Health told APTN that First Nations communities will have access to COVID-19 testing through federal nursing stations, and nurses can also assess patients to determine if they need to be sent out of the community. To date, nearly 17,000 people have been tested. Elena McDougall, APTN National News, Hamilton.
And Alberta is now reporting its first death, a man in his 60s who had underlying health conditions. Hope to bring you more on that tomorrow. The province of New Brunswick has been the latest to declare a state of emergency, reporting 7 confirmed and 4 probable cases of COVID-19. Angel Moore has that story.
New Brunswick declared a state of emergency in its efforts to flatten the curve, but the province would not specify how it would be enforced. I asked Premier Blaine Higgs what the province was doing to help Indigenous communities.
Our goal is to manage this, flatten this curve so we can stay within the capabilities of our health system. We're seeing a lot of action happening now within the system in order to control this and not let it get to a point where decisions have to be made that are, let's say, a necessity rather than just part of the routine business.
Regional Chief Augustine said everyone has to come together and keep everyone safe.
And I'm going to do that for the next while to, reassure people that if the worst happens, that we are here, and then we'll make all governments to respond.
But Augustine says that all the regional chiefs are keeping track of all the provinces to hold the government accountable. Angel Moore, APTN National News, Chibuktuk, Halifax.
And the Prime Minister says the government is working overtime to ensure there's enough testing for COVID-19 across the country and in communities that need it the most.
Access to COVID-19 lab test kits and other medical devices. The reality is that the need for these test kits is growing. Yesterday, Dr. Tam said that officials have now tested more than 50,000 Canadians since the beginning of the outbreak. 25,000 of those were done just in the last week alone. So while we ramp up, we're making sure Canada is ready to keep up. Ministers Haidu and Minister Freeland will continue working with the provinces and territories so that everyone has the resources they need.
Prime Minister also says $25 million is going directly toward supporting Canadian research teams working to learn more about COVID-19. Well, still to come, how the pandemic is affecting one of the most vulnerable locations in Canada. Stay with us.
Hello, I'm Todd Lamourand, and here's what we're working on for Nation to Nation. There's been a flurry of announcements recently regarding Indigenous people and COVID-19. We'll have 2 senior officials from Indigenous Services and the First Nations and Inuit Health Branch to explain how the federal government plans to keep Indigenous communities safe. As well, I talked to 2 members of Parliament who represent ridings where several Indigenous communities are located. They'll weigh in on whether Ottawa is doing enough. That's coming up immediately after the national news.
Here's a look at Friday's weather forecast starting on the East Coast. +10 and showers in Halifax, 0 for St. John's, -2 with snow for Happy Valley, Goose Bay, 22 below in Inukjuak, 13 above in Montreal, +10 and showers for Saguenay, 15 above in Toronto with rain, +17 and showers for Ottawa, -4 with snow on the way for Thunder Bay, 8 below and snow in Sioux Lookout, -19 for Churchill, -11 in God's Lake, 10 below under sunny skies for Winnipeg, Princess Harbour and Barons River, -5 in Regina and Estevan, 8 below in Yorkton. -6 for Meadow Lake, 5 below in La Ronge. Welcome back. Nunavut confirmed today that there are no positive tests for COVID-19 in the territory. However, some people are taking their own steps to maintain that status. This photo comes from Rankin Inlet, Nunavut, where people have started blockading the entrance to the neighboring gold mine. A group of workers from Quebec had arrived, and the residents didn't want them to get to the mine because so many Rankin Inlet residents work there. Now, Nunavut Mines have sent Nunavut-based staff home with pay, and the Economic Development Minister thinks everyone can work it out.
Our staff have been in contact with the mine and also with everybody that's involved and try and figure out what the solution is going to be.
The Northwest Territories also has no cases currently of COVID-19, but that doesn't mean residents and businesses haven't seen some drastic changes. Our reporter Charlotte Moore-Jacobs has an update from Yellowknife.
This is one of the last Air Canada flights leaving Yellowknife. Airlines are beginning to scale back and suspend domestic routes to, from, and within the Northwest Territories. This comes amid precautions around COVID-19.
I've decided to declare a territory-wide public health emergency on the advice of our Northwest Territories Chief Public Health Officer, Dr. Cami Condola. It gives our Chief Public Health Officer the authority to order any measures she sees necessary to prevent the spread of the COVID-19 here in the Northwest Territories.
Government says those measures may include authorizing qualified people to provide extra services as needed, speeding up emergency licensing of additional healthcare providers, and providing directions on restricting travel to or from anywhere in the territory, among other binding measures.
Point of this public health requirement right now, public health measures, it's all about social distancing. It's about minimizing opportunities where a COVID-19 can enter, gain foothold, and spread quickly.
As of Wednesday, 153 tests for COVID-19 in the territory had come back negative, while over 100 more awaited analysis. Test results can take up to 1 week as they are sent down to Alberta. Anyone arriving from outside the territory is being told to self-isolate for a mandatory 2-week period upon arrival. Schools are out until at least April 12th. City, town, and hamlet-run facilities have closed or are about to close. Public gatherings of 50 are banned, and one of the territory's largest employers, the government, have made non-essential workers work from home. While there are currently no cases of COVID-19 in the territories, precautionary measures are being taken to slow the flow of the virus. Charlotte Moore-Jacobs, APTN National News, Yellowknife.
With health officials telling people to stay home and self-isolate over the next few weeks, advocates are sounding the alarm for those that are struggling with addictions who say they can't self-isolate. Tina House has more.
At this press conference at City Hall, Trey, who works with the Overdose Prevention Society, had a question for city officials.
Peer workers who are currently using drugs don't get a day off. They can't stop, take a break if they're addicted to opiates. What will be done about safe supply if they have to take a break from working and they're still addicted to opiates?
We are in active discussions with VCH. This is an area of their lead, but the consideration of access to critical medications and critical safe supply is something that we're in discussions with them on. So I don't have an answer for you right now. These discussions are happening kind of real time.
And many down here, like Kimberly Baptiste says, time is of the essence. If COVID-19 does strike on Vancouver's downtown east side, the advice from health officials to self-isolate won't work.
There's not very many places to go to the washroom in the middle of the night, and to keep our hands clean is going to be really hard.
Kimberly has been addicted to fentanyl for over 10 years. It's something she struggles with every day.
If they're asking us to stay isolated, there's no way to stay isolated if you don't have like what you need to stay isolated, like I've seen people literally crawl the walls when they're like needing fentanyl, and it's way worse than heroin ever was. So they need to just help more.
Mayor Kennedy Stewart says they are focused on providing more resources to people on the streets.
My top priority right now is to ensure we do all we can to slow the spread of the virus and to make sure our most vulnerable neighbors are safe, especially seniors and those living in SROs or who are experiencing homelessness.
But for Trey, help can't come soon enough.
People in the downtown east side, they all have compromised immune systems, and if it gets down there, it's going to be pretty scary. A lot of my friends are going to get really, really sick.
The city is erecting 10 hand-washing stations. Meanwhile, people still continue to gather on the downtown east side. Tina House, APTN National News, Vancouver.
Saskatchewan has also declared a health emergency over COVID-19. The province now has one confirmed case and one presumptive case, and those cases are on First Nation territory. APTN's Priscilla Wolf has the story.
The province now has one confirmed case and one presumptive case in South End. The person that has tested positive had been traveling in Africa and is now under quarantine. Anyone that has been in contact with the person is also under quarantine and being tested. Meanwhile, people in northern Saskatchewan are running low on supplies and their store shelves are empty. The Prince Albert Grand Council says they are worried about the lack of food and supplies for the north. Al Descharmes, the executive director for the Prince Albert Grand Council, says
there's a number of things that are happening in the north, and we're trying to deal with them all at one time while the entire country tries to deal with things.
Descharmes says they are already facing a real state of emergency.
We are somewhat different because we have an entire half of the province where our First Nations mostly live. We have a total population of close to 80,000 First Nations in northern Saskatchewan, and that's for whom we look after.
Grand Chief Brian Hardlott says the north already is seeing a need for food and supplies.
It's important to protect supply line, and it's being shut down and choked. And firstly, we are calling on the government to ensure that food and essential supplies are designated for the north and our more remote communities. And secondly, we are calling for reliable delivery system. And if it means calling in the military with their big aircrafts, they call them Hercules aircrafts, then that's what we'll ask for.
He adds the province has declared a state of emergency to make funds available, but he's worried it will take longer to get funds and supplies to northern communities than to other parts of the province.
With the indigenous communities, especially the remote communities, how are we going to deal with this? How is this money going to flow? And that's a very important question because nobody really knows how this money is going to flow, the money that's been announced.
Priscilla Wolf, APTN National News, Prince Albert.
We'd like to hear how COVID-19 is affecting you. Here's how to continue the conversation. Send your emails to news@aptn.ca. Find us online at aptnnews.ca and on youtube.com/aptnnews. You can also follow us on Facebook, Twitter, and Instagram for the latest Indigenous news. In other news, a high-profile murder case was in court this week in Manitoba. APTN's Daryl Stranger has been going over the court documents and joins us from home to discuss the details. Daryl?
Yeah, thanks, Dennis. A former high school principal from Sagkeeng First Nation pleaded guilty this week to 2 counts of second-degree murder in Winnipeg court. Claude Guimont was charged with the vigilante killing of 2 men, 43-year-old Jody Brown and 35-year-old Stephen Cheverfies, who were found shot to death in a well-known drug house in the nearby community of St. George, Manitoba. The victims were shot in front of other people who were in the house. The Winnipeg Free Press reports that, according to an agreed statement of fact, the court heard Guimont had been drinking when he painted his face black and dressed in camo on February 28th when he went to a well-known drug house armed with a gun. Guimont told the court Monday he regrets his actions. Now, both the Crown and defense recommend a life sentence with no chance of parole for 14 years. Meanwhile, the community remains divided on the matter, with social media being filled with people saying he did the community a favor and this wouldn't have happened if police had done their jobs, while others say no one, even drug dealers, deserve to be killed. Justice Brenda Kaiser adjourned court for written reasons, and the matter is set to return to court on May 13th, when Guimont will be sentenced. Dennis, back to you in studio.
Thanks, Daryl. We've got to step aside for another break, but when we return, we'll look at the scams popping up during a time of crisis. Here's a look at the rest of Friday's weather forecast, picking back up in northern Alberta. 0 under sunny skies for high level. -1 in Medicine Hat, +3 and sunny in Calgary. 12 above for Vancouver, +14 under sunny skies in Campbell River. +9 in Smithers, +7 for Prince George. 1 above in Old Crow with snow, +2 in Watson Lake. 7 above under sunny skies in Fort Liard and Trout Lake. -5 for Sask Harbor, +1 with snow for Coldale Lake. -25 in Baker Lake, 23 below for Repulse Bay. -23 in Arctic Bay, 20 below in Igloo Lake. Welcome back. Police and health agencies are warning people about scammers trying to make a fast buck off the COVID-19 pandemic. The Red Cross is warning not to click links in text messages claiming to be selling masks. The Mohawk Council of Kahnawake issued a lengthy warning. The people are even posing as police officers and demanding on-the-spot fines for folks wearing masks, saying it's against the law. And that fraudsters have gone door-to-door in some areas offering pricey and fake decontamination services. And another warning out there not to fall for deals on COVID-19 tests, which are currently only available at medical facilities. For a list of common scams and tips to stay safe, you can visit the Canadian Anti-Fraud Centre's website. Pretty sad. Well, that is your APTN National News for this Thursday. Stay up to date with the very latest by visiting our website, aptnnews.ca. Stick around. Nation to Nation with Todd Lamarand is next. We leave you tonight with some video of Sky. She's a jingle dress dancer from the Navajo Nation in Arizona. I'm Dennis Ward. Have a great night. See you back here tomorrow.
Hi guys, my name is Sky Yanavapula. Today I wanted to do a dance for the people who are sick from the coronavirus and who are scared and anxious and need healing.